Joining us live now is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, always good to see you. Let's get into it this morning. The U.S. Centers for Disease Control and Prevention says that the amount of coronavirus being detected in wastewater, that's the percentage of people testing positive for the virus, and the number of people seeking care for COVID-19 at emergency rooms, all started increasing in early July. Hospitalizations are up 10%. So when you hear of this data, what does that say to you?
Yeah, I mean, obviously, we don't want anyone to get sick with COVID-19. But if you take a step back and if you look at the trends over the last few years, these summer waves of COVID are not surprising in the southern United States. We're seeing the trend all over the United States, but it's more pronounced in the southern states. You see it in mostly in Texas, Alabama, Mississippi, Florida. It's even seen in California. It's really, really hot in the southern United States. We know people are going indoors for air-conditioned spaces, and we know COVID-19 is primarily transmitted through the air in indoor spaces between people. And when you've got a lot of people congregating indoors, in this case, because it's hot and you want some air conditioning, you know, it's just a more, the virus can be transmitted more readily. So if you look at those trends from 2020, 2021, 2022, and now 2023 summers, you see a rise in cases. We'll probably start to see a rise in cases in, the mid to late summer or early fall in Canada as well. And again, we have the tools to prevent COVID-19. We know how we can prevent this. We know, masking in crowded indoor settings helps reduce the risk. We know that the vaccines reduce the risk of severe infections such as hospitalization and death. And again, we can help create safer indoor environments with better quality air indoors. So again, it's no secret how to prevent this and how to treat this at this point in time. But yeah, we can expect to see a rise in cases probably in Canada, maybe late summer, mid to late summer, or early fall as well.
Okay, and turning to the fight against COVID-19, a recent study suggests that newly discovered antibodies can neutralize virtually all known variants of COVID-19 and potentially prevent any future outbreaks. So what would this mean in the battle or the fight against COVID in the future?
Yeah, this is really interesting. There was a person in Singapore who survived SARS in 2003 and was vaccinated against COVID. They found antibodies in this person's blood that were very powerful in terms of neutralizing not just COVID-19, but lots of different types of coronaviruses. So this is a really interesting study. And this is obviously very early, but the next steps would be looking at how you can use this knowledge, these antibodies, to create smarter vaccines that better target the virus and better prevent infection, or use this knowledge to create better therapeutics as well in terms of treating people who are sick with COVID-19 or other coronaviruses. So very early, but a really interesting discovery that probably has significant ramifications later on down the line.
Yeah, it sounds pretty big. All right, Dr. Bogoch, we're going to do a bit of a throwback and give you a viewer question this morning. This one comes from Joan. Joan, our viewer, writing in to ask, many seniors and others are due for a COVID-19 booster vaccine and are wondering when one targeting new variants such as XBB.1.5 will be available. Is it better to wait or get what is available right now?
Okay. Yeah, I feel like it's 2020 again. We're getting viewer questions. But the short answer, for individual medical decisions, you've got to talk to a healthcare provider. You absolutely have to talk to a healthcare provider if you're going to make an individual medical decision in terms of should I get this now or should I wait? In general, for people who are at risk of severe COVID-19 infection, usually you would wait 6 months after your most recent vaccination or 6 months after your most recent infection. However, the National Advisory Committee on Immunizations has said, listen, most people, not everyone, but most people should be waiting until the fall for this newer vaccine, this booster vaccine campaign to launch. They said fall. So that's, September, October-ish, something like that. Having said that, for individual medical decisions, if you're wondering what's the right thing to do for you, the smart thing to do is talk to a healthcare provider.
Yeah, always the safest bet. Dr. Isaac Bogoch, thank you once again. We'll chat with you next Tuesday. Have a great week. Take care.